respiratory depression. So if we're trying to maintain a quality of life, and they're just sleeping day in and day out, they may not be painful, but how's their quality of life, and how's your quality of life? It's not rewarding when we watch our pets just sleep all day long. Okay, maybe we've made them feel better, but that's not the interaction we want to have with our pets. Unless it's, if they're a beagle that sleeps 23 hours a day as it is, then maybe that's normal. But I don't want to give your dog so many drugs that I keep them sedated. They work really well. They are very safe at the right doses. There's also the risk for mishandling, theft. You can have, nobody ever wants to think of this, but obviously there's always a risk. A lot of these are more human drugs. So we have to be very mindful of that. And so we have to keep very close track of how many we dispense, how often we dispense it, and keep an eye on things. So there have been incidences of what we call diversion, where we're getting phone calls too often for refills. And so if we start questioning you, just know that we're trying to look out for everybody involved, right? But again, they are very, very safe. These are most commonly used for deep pain, really severe pain. If your dog skins its knee, or if your cat jumps off the bookshelf and seems a little stiff, we're not putting them on opiates. This is for severe pain. Because again, the side effects of sedation are not usually worthwhile for something that's going to clear up in 2 or 3 days. And then we get down to nerve pain agents. That's gabapentin. We don't know how it works. It just does. It is good. It is good. And we use it in combination with a lot of things, because by itself it's usually not that great. But when used with something else, we do get that synergistic effect. When used with opiates, it almost always causes sedation. So these are the drugs. Then we've got the non-drug options. These are the no side effects options. We love no side effects. Who takes glucosamine for their own joints?
I used to.
Okay. Glucosamine chondroitin. We've been talking about glucosamine chondroitin in humans for years, right? It's not a new thing. What does it do? It gives you the building blocks for your cartilage. Healthy cartilage means happier joints. So what we want to try and do is help with happy joints. That helps reduce inflammation. We often like to do this for patients that we know are high risk. That Mastiff puppy that we see, he's 50 pounds at 4 months old. He's going to be enormous. We're probably going to start recommending joint support for him at 2 years of age. Because he doesn't have joint disease necessarily, but we can anticipate it. And that's where we start talking about this anticipatory thing. And then we've got Adequan. Adequan's an injection. Maybe you would feel comfortable giving your pet injections. Okay? Yeah. Like, some people will, some people won't. We teach you how to do it, or we bring them in, but it's actually an injectable product that provides the building blocks for joint fluid. Lubrication is good. Your car doesn't run without oil. Your pet's joints don't function well without joint fluid. So Adequan helps us provide more building blocks for joint fluid. It's also one of the most popular options for cat pain management. I went to a feline pain management seminar, and what they said was gabapentin, Adequan, glucosamine. That's like or an acupuncture. Those are the things that they come back to for cats and pain, because again, they're hard to treat safely. So omega-3 fatty acids then come into play. Those help strengthen cell walls. So now we have healthy cells, we have healthy cartilage, and we have healthy joint fluid. This is a great combination for preventative pain management. And they're all, again, free of side effects generally, unless your dog's sensitive to the flavorants in the product or something like that. So if you have a dog with food allergy, most of the veterinary glucosamine chondroitin supplements are flavored with beef, so you gotta give them a human product. Oh no, don't make me go to Costco. So that is kind of the drug thing. There's a lot there. Yes, ma'am?
Just want to ask a personal question.
Absolutely, I was gonna take questions before we move on.
Okay, the omega-3,
Mhm.
give it to any pet?
Any pet. It's good for
Even, my two is what I meant,
Right.
personal. And then the glucosamine, should I be giving it to Taz yet?
Taz is a baby. Taz just turned 1. She's also not a large breed dog, and she's conformationally sound.
Okay.
So these dogs that have a really long back, like a dachshund, a corgi, anything where they're disproportionate, where they've been developed to have a disproportionate body,
Yeah.
are going to have higher risk. Anything that's giant, large, or giant breed is going to have higher risk. But the dogs that are really square, where they're as long as they are tall, are going to have lesser risk for joint issues because they're structurally built to just stand at 90-degree angles.
Yeah.
So Taz, I'm not worried about, but I'll talk to you when she's 5.
Okay, but keep,
Comment, yes.
and also the omega-3,
I believe in fish oil. It's good for skin. It's good for inflammation. It's good for coat quality. There's just no good reason not to use it. So they come in capsules. You can buy it in like big pump jugs. The grizzly salmon oil, the dogs love it. It smells like salmon. It's almost fluorescent pink. It looks like condensed salmon. It's terrible. It is. So I give my dog something that we sell here because it's a really concentrated formula and they're big dogs. And I don't like having to give 3 capsules of the human product. But you can also do it in liquid. Yeah, that one. So this is, yeah. So this is, in this capsule there is, 2,000 milligrams of fish oil in one capsule. Most of the time with a human product, you have to do 2 capsules to get 2,000 milligrams. Now what's important to note here is that there's 2,000 milligrams of the actual oil. What we're concerned about is the omega-3 fatty acids, the EPA and DHA. That total dose is what you're looking for. And I'm going to pass this around and let you look at the label, but this has a total of 600 milligrams of those omega-3 fatty acids. 2,000 milligrams of fish oil, only 600 milligrams of the omega-3s. Really important distinction. So if you're taking 1,000 milligram or capsule that's a horse pill size and you're only getting 300 milligrams, well that's a pain in the butt. This is 1 capsule. Oh yeah, mine likes to pop them. Yes.
So what's your recommendation, like, per kilogram for the glucosamine chondroitin or the?
I kind of do a loose dosing range, and it's really, really safe. So anything under about 40 pounds, I'll do 500 milligrams to start. Anything over Colt, I'm going to put, and especially because of Colt's other things, and namely his girth, I'm going to.
And he's on a diet.
Yeah.
He just won't lose weight.
He is a challenging case, but for Colt, I probably put him on 1,000 to 1,500 milligrams
Of the
because I can't hurt him with it. And the severity of joint disease is going to change what dose we give. If you give 75 milligrams per kilogram of omega-3 fatty acids, so that means for a 22-pound dog, that's 10 kilograms, 750 milligrams of fish oil. That's more than one of these capsules. One of these capsules labeled for a 60-pound dog. So if you're giving a 20-pound dog an 80-pound dog dose, there is one study that suggests it may slow their clotting times, that it may impact platelet function. But you have to really overdose them on it. The biggest issue is if you give too much fish oil, slides everything out the back end. It's too much oil. So I'm going to pass this around, let you look at the label so you can see what it looks like. But these are really safe things.
Is that forever?
It is not, but those are capsules. Anything that's in a capsule has a gelatin capsule. Gelatin is beef-based. It is derived from beef bones and cartilage. So what you can do is perforate it with a safety pin and just squirt it on that food. Because I know you're talking about Miss Maggie. So yes, for food-sensitive dogs, be mindful that gelatin capsules are beef-based. Most dogs don't react to them, but if you've got a food allergy dog who's controlled and they suddenly have a flare-up, it may not have been worth using those whole capsules. So, what other questions do you guys have about this before I move on? Yes?
Alright, what about the dose for the glucosamine chondroitin? Same dosage?
Right. Oh, so I thought that's what we were talking about. 500.
I thought we were talking about the
Okay. Glucosamine, 500 milligrams for anything under 40 pounds, 1,000 milligrams or up
Okay.
for anything bigger than that.
And it's the same for the omega-3?
For the omega-3s, basically, if it's over 50, I want 600 plus milligrams of the total omega-3s.
Okay.
There are actual dosing regimens, and any individual pet, we can have that discussion after the seminar if you want specific dose recommendations. But again, they're super safe. So if you're like, what do I have in my cabinet? Oh, I have 1,000 milligram fish oil capsules. you're probably not going to hurt your pet with them, unless, again, they have a beef allergy and are sensitive to the gelatin capsules, or if they have really sensitive GI tract. For whatever reason, I can give my dogs the capsules, but I can't give them loose oil. Like I can't do the pump oils or squirt oils, or I'm cleaning up diarrhea. This is not pleasant when you live on Capitol Hill. Your neighbors don't like you very much. So, I do think it does. I really do think there's a brand issue. There was a recent study on nutraceuticals. Nutraceuticals is a neat word. It's basically anything that wants to be a pharmaceutical that isn't FDA regulated. It's a nutritional supplement that they want to act like a drug. They are not regulated. Supplements are not regulated. And there's been several studies that say that what's on the label is not what's in the pill or capsule. So brands do matter. So if you're doing a veterinary product, we're going to carry products we believe in. If you're doing a human product, use really good brands. So if you're just going for glucosamine, I'm going to pick out the Move Free because I know that that one's good. That's a good brand. But generally, we're going to use veterinary products because I like handing my dog a flavored tablet. They take it like candy. But if you're using human products, and we're more than happy to go over individual brands with you, but it is important to be mindful. And each brand is different. If you're looking at veterinary products, Ginny, would you mind handing me one of the bottles of Glycoflex? There's an outside certification body called NASC, National Animal Supplement Council, which allows for third-party verification of their product. So this label, NASC, this label indicates that the company believes so much in their product and their manufacturing facilities that they allow a third-party inspection of their facilities and analysis of their products. That's pretty upfront. I mean, if they'll let somebody else, not employed by them, come and inspect their products and their facilities, you can trust them. I worked with Susan Wynn, who's got more degrees than she knows what to do with. She's a veterinarian who quite literally wrote the textbook on holistic medicine, but then went back and got board certified as a specialist in veterinary nutrition. She actually works with NASC in developing their protocols, and I really believe in the certification process. So if you're at the pet store and you see something that says NASC, pick that over something that doesn't. Unless it's a brand that we know and love, which is Cosequin, or any of the Nutramax love, Cosequin, Dasquin. Those come, yeah. So that's what I want you to look for. Supplements matter. We don't want to give them anything where they could be hurt. They could be harmed. The other thing is, we've all been hearing these media outcries about things made in China. So this is not to villainize China, but I see a lot of poor advice coming from well-intentioned pet store employees. They have nothing but the best intentions for your pet and for you as a client, but they may not have all the information at their disposal. So your task is to be an informed consumer. Look for that label. Or if you're not sure, ask us. We're happy to take your phone calls. Okay, any other questions about drugs? Okay. And if you have specific questions about your individual pets, I'm happy to talk to you after the meeting. I do want to talk briefly about surgical pain management. Because there are scenarios where a pet may be severely painful that may not be drug responsive. Examples of this include really bad fractures that won't heal, infections of the bone, really bad hip dysplasia. Pugs are prone to something called femoral head necrosis, and they literally have congenital disease where the head of the femur, which is that ball in the ball and socket joint, is just destroyed. You take an x-ray, it looks like cat litter in the joint. It's not good. We will never make that pet comfortable, no matter how aggressively we try. And so what we do is we actually will do surgery to remove that femoral head. You've just removed the ball from the ball and socket joint, so now they're supporting that limb on muscle alone, but they're not painful. Are they going to walk like a normal dog? No, but they were a pug, so they probably didn't in the first place. So what we, again, want is we have to weigh the benefits of surgical correction. Hip dysplasia, knee surgeries, congenital issues, fractures, infections of the bone, spinal disease. These all have surgical management options. If your doctor says to you, I really think surgery is the best option, there's a reason for that. And we don't like doing a lot of these orthopedic surgeries. They're not fun surgeries. They're white, you know, it feels like carpentry. It's not